So basically, this topic, I'm going to talk about the introduction to anatomy and more specifically on the anatomical terminology. What are the terms that normally we use in anatomy, and also when you practice as a nursing later on, or any other degrees or any other program, like biomedicals or nursing or dietetics, all the terminology in anatomy will be similar. All right. So basically, for today's lecture, it's more on the terminology in anatomy. So basically, what's the anatomy actually? So in general, when we refer anatomy, it tends to mean gross or macroscopic anatomy. So gross anatomy means any structures that you can see using your naked eyes, things that you can see using your eyes. So, or sometimes we call it a macroscopic anatomy, right? So the study of structures of the body that can be seen without using a microscope. If you use microscope, then it becomes microscopic anatomy or histology. Microscopic if you use a microscope. Anatomy form the basis for the practice of medicine, because in any scenario or in any field, medicine, nursing, biomedics, or anything, or health sciences, of course, the fundamentals about the structures of the anatomy of the body is the basic knowledge that you need to learn before you further study on the other discipline. So how we study anatomy? So basically, gross anatomy can be studied following either a regional or systemic approach. What do you mean by regional? Regional means that we divide our body based on the parts. Examples, your head and neck area, your lower limbs, your trunk, and also lower limbs. So for example, if you learn about the head and neck, you will learn everything about the skull of the, about the bone of the head and neck, the muscles of the head and neck, the blood supply, the nerve, and so on. It means that you study everything for the regional approach. But for systemic approach, you study anatomy based on the system. Examples, skeletal system. So you study about the bone of the body. Or you study about the muscular system, muscles of the body, and so on. As for this subject, for this paper, it is more systemic approach. It's more on the systemic approach. As I mentioned earlier, this is a subdivision of anatomy. You know it's a gross anatomy and also histology, right? And then we have embryology and also neuroanatomy. So basically, embryology is a developmental anatomy, how the fetus develop in the womb, and also neuroanatomy related with the nervous system. For this paper, most of the topic will be on the gross anatomy, and also there's a topic on the nervous system, then it becomes neuroanatomy. All right. So as mentioned earlier, the regional approach, each region of the body is studied separately and all aspects of the region are studied at the same time. Whereas for systemic approach, each system of the body is studied and followed throughout the entire body. So basically, it's a regional anatomy that can be divided into region. For example, your head and neck. The limbs can be divided into upper limbs, lower limbs, and also a trunk. Trunk consists of thorax and backs, abdomen, pelvis, and perineum. So this is how when you learn anatomy, regional or systemic. For systemic, it's based on the system. Example, skeletal system, articular system, muscular system, nervous system, and so on. So it's based on the system. So as a clinical anatomy, clinical anatomy is the study of the macroscopic structures and functions of the body as it relates to the practice of medicine and other health sciences. So that's the definitions of the clinical anatomy. So what is the surface anatomy? So technically, surface anatomy is that surface projections of deeper structure study. When you learn anatomy, then at the end of the semester, you should be able to recognize what are the structures found deep to the skin. So that's why you need a mental knowledge of that particular information. Then you can explain later on by touching on a certain part of your body. Then you can explain what are the structures underneath your skin in general, right? So surface anatomy is a mental picture of the important structures of the body from the basis of physical examinations. So when you do the physical examination, of course, you like to see for that particular structures, is it normal or is it abnormal, right? Of course, in order to do that, you must have basic knowledge of anatomy, especially surface anatomy. So anatomy and medicine have an international vocabulary, means that wherever you go, we are using the same language, the same words to describe the body clearly and to indicate the positions of its part and organs related to each other. Anatomists around the world have agreed to use the same descriptive terms of positions and directions. So basically, all anatomical descriptions are expressed in relation to the anatomical positions to ensure that descriptions are not ambiguous. So basically, whenever you go, when you're explaining about the structural or the anatomical features of the organ or structures, they should be similar. Right? So basically, when you refer or explaining any structures in the body, it must refer to the anatomical positions. So what is the definitions of anatomical position? First, you're standing erect. You're standing erect. Head and eyes and toes directed forward. Okay. Heels and toes together. And then upper limbs hanging by the side with the palm facing anteriorly. The bones of the body in anatomical positions. Facing forward, upper limb hanging by the side, standing erect, the palm facing anterior, heels and toes together, right? So these are the definitions of anatomical positions. Now, again, when you describe any structures in relation to anatomical position, of course, you need a reference point, a reference line, or here we call it plane. So basically, this plane, this various part of the body are then described in relation to certain imaginary planes. So technically, there are three: sagittal plane, coronal plane, and also horizontal planes. And then for coronal, it can be sometimes we call them as a frontal plane. Horizontal, also known as a transverse. Depending with the book, sometimes they're using coronal or frontal. So referring to the same plane actually. Okay, we start with sagittal plane. Okay, under sagittal plane, so it can be further subdivided into median plane and also paramedian plane. Or median plane also known as a mid-sagittal plane, and paramedian is a parasagittal plane. For sagittal plane, I prefer to use median plane or parasagittal plane. So simple. So this plane basically will divide the body equally into left and right. Divide the body into left and right. The median plane will divide the body equally left and right. Therefore, in our body, there is only one median plane. Only one median plane. Remember, because it will divide the body equally in the midline. Whereas if this plane shifted to the right or to the left, they become parasagittal plane. So this parasagittal plane can be more than one, because towards the right or towards the left. So okay, the median plane, some would use a median sagittal plane or mid sagittal plane, the same thing. But I prefer to use a median plane. It is a vertical plane passing lengthwise through the midline of the body from front to back, dividing it equally into right and left half equally. This is a median plane. Median plane is here. So how about the parasagittal plane? Any plane that parallel to the median planes. It can be to the left or to the right. All right. So this is a median plane here. And the sagittal plane. In general, this is a sagittal plane. And then the one that in the midline, it is known as median plane. And the other plane will be parasagittal plane. Parasagittal plane. Second is a coronal plane or frontal plane. A vertical plane at right angles to the median plane that will divide the body into front part and back. Okay, so this is your coronal plane. Right? That will divide the body into front part and also back. Okay, this is a coronal plane. And then the transverse plane, a plane at right angle to vertical plane, divide the body into superior and inferior part. It can be at any level. They will divide the upper part and also the lower part. This is a transverse plane. This is a transverse plane. So again, this is a various line that describing the different type of plane. So you have coronal plane, median plane, and also horizontal or transverse plane. Again, it's a median plane, and towards the right or the left is a parasagittal plane. Okay, now it's the sections of the body. So do not confuse with plane, because sections of the body refer how we prepare the specimen. In the practicals, sections means how you cut the specimen. Examples, all right? If there is a specimen of the, let's say, heart, your heart, and then the heart was cut longitudinally. Longitudinal means we cut following the long axis of the structures. All right. So this section means how we prepare the specimen. Examples in the practicals: your hand or your forearm here was cut cross-sectionally or cut longitudinally. Longitudinal means cut following the long axis of the structures. So basically, run lengthwise in the directions of the long axis of the body or any of its part, and they are applicable regardless of the positions of the body. Maybe cut in the median, sagittal, or coronal planes. It depends with the organ or structures that you prepare or that you cut. That's it. In the practicals, I give you a specimen and then I say that, oh, this specimen was cut longitudinally. All right, you should be able to understand what you mean by longitudinal sections. The transverse section is a cut at right angles to the longitudinal axis of the body or its part. It's a transverse section. Or in bahasa, we call it a potongan rentas. Potongan rentas. Whereas the longitudinal section known as potongan memanjang. Potongan memanjang. So it's a potongan rentas. And then the third is oblique sections. Is any sections not cut in one of the main planes of the body. Or in bahasa, we call it potongan sengit. Potongan sengit. Or oblique section. All right. We're done with planes and also sections. I hope at this level, you'll be able to differentiate what you mean by plane and also sections. Now, terms of relation used in cross anatomy, you have anterior and posterior. When you describe anything located in front or back or behind, in medical, we use terminology like anterior to describe nearer to the front of the body or in front, or posterior for the nearer to the back of the body or behind. Right? So after this, when you explain anything located in front, you use anterior, and the one at the back, then we call it posterior. Same meaning if you use ventral and dorsal. So you can use ventral to describe this structure located in front, and then you use dorsal to describe the structure located behind. But do not mix between anterior, posterior, ventral, and dorsal. Do not use, when you use anterior, the other is a dorsal. No, you must use their couples. Examples, you explain anterior, the opposite will be posterior. If you use ventral, the opposite should this dorsal. Right? Okay, now superior and inferior, very simple. Superior means toward the head or upper part of the body, whereas inferior towards the feet or lower part of the body. Yeah? Or you can use cranial and caudal to present superior and inferior. Cranial and caudal. All right. So technically, caudal is towards the tail, whereas cranial is towards the head. Or for superior, you can use cephalic. Cephalic means towards your skull, cephalically, towards the head. All right. Okay. Now, medial and lateral. Remember the plane, the median plane just now? So for medial means towards the median plane of the body, whereas lateral, farther away from the median plane. That's when you're comparing between the 2 points, between the 2 points, which one located nearer to the median plane? The one that nearer, then we call it medial, or facing on the medial. The one farther away will be lateral. So that's how the definition between medial and also lateral. But do not confuse when you read about medial, middle surface, lateral surface. Middle surface means the one that's facing the median plane. The lateral surface facing outward. All right. So that's the medial and lateral. That's another terminology to describe anterior, especially for the skull. So you have rostral. Okay. Examples: bone of the nose here located rostrally, located anteriorly. All right. Of course, it is rostral. The one at the back is anterior, is posterior. Or sometimes you can use caudal as well. Okay. All right. So how about the terms of proximal and distal? It refer nearest to the trunk or point of origin. Examples, your upper limbs here, your upper limbs here. Of course, on the armpit here is your point of origin. Nearer to the point of origin, then we call it proximal. And the distal part will be the other part. But same thing with your fingers. Of course, the nearer to the origin of the fingers is the distal part. The proximal part. Then the rest is the distal part. Always refer to the point of origin. Just like your artery. Remember artery? So you have blood vessels, and then these blood vessels consist of proximal and distal part. And then once they branch, that's where the point of origin. And then you can differentiate between the proximal part or the distal part. For example, in the report, when you read the report, due to the accident, the proximal part of the artery A is affected. So you know which part of the artery will be affected, right? Or due to the accident, the distal part of artery B is affected. So the distal part will be the farther, all right? That's the differences between proximal and also distal. Superficial and also profundus. That's when comparing between structures located nearer to the surface. The nearer will become superficial, and then the deeper structure known as a profundus. That's when you're comparing between few layers of structures. The superficial will be located nearer to the surface, whereas profundus will be located deeper. Interior or exterior, very straightforward. Interior is inside, whereas exterior is outside or external. Ipsilateral and contralateral. Ipsilateral on the same side, contralateral on the opposite side. Ipsilateral on the same side, examples, your right eyes, your right hand, they are ipsilateral. Contralateral, your eyes and also your left hand, opposite. They are contralateral. Another examples, nerve A supplying the structure ipsilaterally. So meaning that nerve originating from one side and then the supplying on the same side. Or it can be nerve B supplying the structure contralaterally. Therefore, it is originated from one side. It will supply structure on the opposite side. Just examples to indicate what I mean by contralateral. So as for hand, so this palmar surface and also dorsal surface. Your palm here, your palm is a palmar surface, and it's your dorsal surface. And then for the foot, you have dorsal surface and also plantar surface. Your sole is a plantar surface. All right, the supine positions of the body is lying on the back, and prone position is lying face downward. So here is your supine position, and it's a prone position. Okay. These are structures that will be attached on the floor in supine and also in prone position. Don't worry, it's not just for your added knowledge. Okay, when the structures in our body, they are not exactly located in front, anterior, posterior, superior, lateral, and so on. Sometimes it can be slightly anterior and superior. Then they become antero-superior. Or it can be slightly inferior, anterior and inferior. So antero-inferior. That's when you compare between the two structures. In anatomy, when you describe about the relations, for example, you have one structure. What are the structure located superior, anterior, posterior, inferior, and also lateral? And sometimes this the structure located antero-superior, or it can be lateral superior, superolateral, or inferolateral. So just these are examples of combined terms. So when you read in the textbooks or any report, for example, antero-inferior, then you should be able to guess what you mean by antero-superior, posterolateral, something like that, or supero-inferior, something like that. So that's the combination positions. All right, this for the movement. A site where two or more bones come together is known as a joint. So technically, joints have no movement. Examples, suture of the skull. Some have only slight movement. Examples, superior tibio-fibular joint between tibia and also fibula bone. Some are freely movable. Examples, your synovial joint, like your shoulder joint, they're movable. All right. So this type of movement, first we have flexion. Flexion is a bending or making a decreasing angle between the bones or parts of the body. All right. Usually anterior bending in the sagittal plane. All right. So when you mention about movement, you must mention the name of the joint. Example here in the diagram here. So there's a flexions of the shoulder joint. You flex. And here is a flexions of the knee joint. Or it's a flexions of the elbow joint. You flex. All right. Usually anterior bending in sagittal plane. Remember the sagittal plane? Here is our sagittal plane, right? So flexions and extension normally occurs in sagittal plane. All right. So usually anterior bending. You can see here for shoulder joint, anterior bending, elbow, anterior bending. But as for your knee joint, they are posterior bending. Posterior bending. But the plane occurs in sagittal plane. Sagittal plane. For extension, it's the opposite. Opposite movement of the flexions. Strengthening of a band or making an increasing angle between the bones or parts of the body. Okay, so here, this is how the extension looks like. Okay, you flex, then you extend. Okay, so you flex, and then you extend, flex, and also extend. If you extend beyond its normal range, then it becomes hyperextension. For example, here, if this is a normal range for extension, if you force more than that range, then become hyperextension. Okay. So these are movements of the foot. Okay, A and B. So please guess, what are they actually for A and B? Are they flexions? Are they extensions? Right? So basically for A, both A and B both are flexions. For ankle movements is unique. For A is a dorsiflexions. Remember the surface name here? Dorsal and plantar here. So this movement is a dorsiflexion of foot, and this movement is a plantar flexion. Plantar flexion, dorsiflexion. So it's a lateral bending movement of the trunk in the coronal plane. All right, you bend. All right. ABD, abductions, movement of a limb away from the midline of the body in the coronal plane. Remember the coronal plane? So for ABD, abductions occurs in coronal plane. All right. Okay. Movement of a limb away from the midline. This is ABD abduction. Abduction will be on the opposite. Movement of a limb towards the body in the coronal plane. ABD, ADD. All right. Abduction and adduction. Okay, for your fingers. Remember, go back to the anatomical position, what it looks like. Okay. And then for fingers, excluding your thumb here, as for fingers, you have out and in, out and in. So the axis will be in your middle finger. This is the axis of the movement, eh? Out and in. Is it flexion extension or is it ABD, ADD? So technically, it's your ABD, it's your ADD. ABD, ADD. All right? Okay. Abduction, adduction of the fingers. They're talking about the 4 fingers. Yeah. Thumb will have a different type of movement. So for your fingers here, of course, you have flexions, extension, ABD, and ADD. All right. So you have flexions, and then you have extension, ABD, and also ADD. How about the thumb? Thumb, okay. How about the thumb here? The 4 movement. ADD, ABD, flexion, extension. Okay. All right. On the palm here, on the surface here. All right. So basically on the surface, you have flexions and extension on the surface. Flexion and extension, and then look carefully, and then you have out and in. So it's a ABD, it's a ADD. All right. Out ABD, ADD. Yeah. But on the surface, flexions and extension. All right. So that's the flexions of the thumb, extension of the thumb is the ABD and also ADD. Yeah. All right. Opposition means a thumb pad is brought to a finger pad. A thumb pad is your thumb here to a finger. Pad is oppositions. of the thumb to your index finger, to the middle finger, ring finger, and also little finger. This is opposition movement. Okay, all right. Example here, opposition of thumb and little finger. Right? All right. Protraction and also retraction. Which part of your body, I'm talking about the joint, the joint that can perform movement anteriorly and posteriorly, means that move forward and move backward. Right? Which part of your body? Huh? So the only part of your body that able to perform protraction and retractions is only your lower jaw. Your lower jaw. So you can try how they looks like. Protraction also retractions. Yeah. You might read in the medical report, due to the accident, his or her lower jaw is protracted or retracted. So technically, protraction is a forward, retraction is a backward. All right. Elevation and depressions. All right. Very straightforward. Lifting, raising, or moving apart superiorly. Depression, letting down, lowering, or moving apart inferiorly. Which part of your body? Of course, your shoulder. Your shoulder. Elevations and also depression of shoulder. These are examples of the extension and flexions of the wrist. So you can check every single joint of your body, and then you can try to try to name the type of movement. Examples, your head. If you do this, of course, it's the flexions of the neck, and it's your extensions. Yeah. So check every single joint, even your hand here. So you have flexions, extension, even the fingers, flexions, extension, and then ABD, ADD, ABD, ADD. All right. Circumductions refers to a circular movement to draw around or to form a circle. Okay, for this type of movement, only possible at ball and socket joint only. So in our body, there's only two places with this type of joint, your shoulder joint and also your hip joint. So because circumduction only possible at ball and socket joint. And this circumduction actually is a combination of four movements. Circumduction is a combination of four movements, which is ABD, ADD, flexion, and also extension. Yeah. All right. Rotation is a turning or revolving of part of the body around its long axis. If you rotate your body. These are circumductions. If you perform this movement, okay, it is possible because of the ball and socket joint. So technically, this movement actually is a combination of flexions, extension, ABD, and also ADD. Right. So these are examples of the rotations of the shoulder joint. All right. So this is a middle rotations of the shoulder joint, and this is a lateral rotation of the shoulder joint. Right? Inversions of the foot and also eversions of the foot. Inversions is the movement of the foot so that the sole faces in the medial directions. The opposite will be eversions, when the sole faces in the lateral directions. So this is inversions, and this is your eversions. This is eversions. Examples in the medical report, when you read, due to the accident, the foot were everted or inverted. So you should be able to understand what by inversion, also eversions. Pronation, supinations. Pronation of the forearm is a middle rotation of the forearm in such a manner that the palm of the hand faces posteriorly. The opposite will be supination. So this is how the looks like. Pronations, palm facing posteriorly. Supinations, palm facing anteriorly. All right. This is pronation and supinations. So this type of movements of the limbs, you have flexions, extension of the shoulder joint, ABD, ADD of the shoulder joint, ABD, ADD of the hip joint, flexor extensions of the elbow, right? And then you have middle rotation, lateral rotations of the shoulder joint. These are circumductions of the shoulder joint, right? Supinations of forearm, pronations, lateral flexion of trunk, inversion, eversions, adductions and abduction of fingers, flexion extension of the thumb, ADD, ABD of the thumb, and also oppositions. Yeah? Now, a very brief on the muscles, all right? Term used for describing muscles, because normally muscle we attach between the two bones. We attach between the two bones, right? So in general, the muscle we have origin attached to one bone and the insertion to another bone. So it's the origin, the other one is the insertion. In between is a belly, right? And this belly part, the muscle part, will be connected to the bone through a tendon. So the green color here is a tendon actually. But for this lecture, we are not going to, for each muscle, you're not supposed to remember what are the origin, what are the insertion. But at least you should be able to understand when someone said the origin of the muscles or insertions of the muscles. Yeah. And normally for the origin, it's a fixed part during the contractions, but the insertion normally is the moving part when the muscles contract. Example here, the gastrocnemial muscles, gastrocnemius. If this muscle contract, so it can be cause the plantar flexion, plantar flexions. When they contract, so it become plantar flexions. Right? So muscles, the three types of muscles are skeleton, smooth, and cardiac. And then the skeletal muscle has two or more attachments. Right? So as I mentioned earlier, for muscles, normally start with the belly, and then the two attachments to the respective bone, known as the origin and also insertions. And before they attach to the bone, it must attach to the tendon first, the tendon, right? And then the ends of the muscles are attached to the bones or cartilage ligament by a cord of fibrous tissue called tendon, as I mentioned earlier. It's a tendon, right? So this is a cord-like structure, all right, for the tendon. But there's a flat tendon, right? So it's a flat tendon, and this flat tendon known as aponeurosis. The flat tendon known as aponeurosis. And this tendon also can be in the form of raphe. Raphe is interdigitation. For example, here, just underneath of your lower jaw here, there's a muscles here, okay, of the malahyoid muscles. So they're connected in between with the tendinous or interdigitation of the tendon here. So this green color here represent the raphe. Okay, examples of tendon, aponeurosis, and also raphe. Now, the internal structures of the skeletal muscles, the individual fibers of a muscles are arranged either parallel, so this is a parallel, or it can be oblique, this is oblique, to the long axis of the muscle. This is the long axis of the muscles, yeah? Okay. So the internal structures of the skeletal muscles, when the muscles contract, shorten by 1/3 to 1/2 of its resting length, and then the fiber runs parallel, greater degree of movement compared with those for those who fibers run obliquely. Okay, this is how the fibers run in oblique. Okay, in oblique. So the run parallel, they have a greater degree of movement. Eh? So it's a relaxed and it's a contracted. So the muscle fiber run obliquely to the line of pull are referred to as the pennant muscles. Yeah? So these are pennant muscles because they resemble the feathers. Yeah? So it can be in the form of unipennant, only one direction, or it can be bipennant, or it can be in the form of multi-pennant. Multi-pennant. So the shapes of the muscles, it can be like rhomboid shapes, quadrilateral, strap with tendinous intersections, or in the form of fusiform, two bellies, one and two heads, one and two. It can be two head like your biceps, and then your three heads like your triceps, four heads like your quadriceps femoris. So depend with the number of heads. Yeah. So these are triangular muscles. These are unipennant muscles, bipennant muscles, multipennant, and so on. All right. So sometimes these features, by looking at the name of the muscle, then you understand. For example, rhomboid muscle. You understand that why rhomboid, because the shape is a rhomboid shape. Example. Okay. Now, the certain muscles actions, all movement are the result of the coordinated actions of many muscles. However, to understand a muscle action, it is necessary to study it individually. A muscle may work in the following four ways. Yeah? Depending with the type of movement, okay, we have prime mover, the main muscles that start the movement, and then the antagonists, the opposite muscles, the fixator, and also the synergists. Yeah? Right? So the prime mover, the main muscles. Yeah? So the prime mover, a muscle is a prime mover when it is the chief muscle or member of a chief group of muscle responsible for a particular movement. For example, the quadriceps femoris is a prime mover in the movement of the extending the knee joint. Okay, so when you extend the knee joint, the quadriceps is your prime mover, and then the biceps femoris here as your antagonist. Yeah. Antagonist, any muscles that oppose the actions of the prime mover is antagonist. For example, the biceps femoris oppose the actions of the quadriceps femoris when the knee joint is extended. So before the prime mover can contract, the antagonist must be equally relaxed. So this is brought by a nervous reflex inhibition. So meaning that in order for you to have a smooth movement, for example, in a sitting position, and then you are in the you stand up. Of course, it involves a lot of muscles, but we concentrate on the knee area. So when you stand up, the quadricep will contract, but at the same time, the biceps femoris will contract as well, but it will release slowly. Why? In order, when you stand up, the movement will be more smooth. Okay, there's no interruptions. Yeah? Okay, that's the main function of the antagonist, to antagonize the movement, to make sure that the movement is smooth. Okay. What is a fixator? A fixator contracts isometrically to stabilize the origin of the prime mover so that it can act efficiently. Example, contraction increases the tone but does not in itself produce movement. Example, the muscle attaching the shoulder girdle to the trunk contract as fixator to allow the deltoid to act on the shoulder joint. Examples, when this is a shoulder joint, this deltoid joint on the shoulder area, your deltoid. So the deltoid will contract, but who stabilizes the joint? That muscle is a fixator muscle. The fixator muscle will stabilize the joint. And then the fixator basically to make sure that the deltoid can function optimally. All right. So muscle around shoulder girdle fixing the scapula so that the movement of abduction can take place at the shoulder joint. For example, here the rhomboid muscles, the stratocentral muscles will fix the scapula. So fix the scapula, and then when the deltoid muscle contract, so your shoulder joint will be stabilized. Yeah? The synergies in many locations in the body, the prime mover muscle crosses several joints before it reaches the joint at which its main action takes place. And to prevent unwanted movement in an intermediate joint, group of muscle called synergies contract and stabilize the intermediate joint. All right. Examples here. For example, the flexor and extensor muscles of the carpus contract to fix the wrist joint here. Okay. So, for example, you have prime mover, extensor digitorum, and also flexor digitorum here. So, assuming if you flex here, of course, for example, you flex here, of course, it will be extensor digitorum. This flexor digitorum will be the we call it the antagonist, and then because this muscle is crossing many joints, so this joint must be stabilized. Who stabilize the joint? The synergist muscles. Yeah. Right. But you need to remember this. Many muscles can act as a prime mover, an antagonist, a fixator, or a synergist, depending on the movement to be accomplished. Yeah. All right. Okay, how we name the muscles? Yeah. Naming of skeletal muscles. The individual muscles are named according to the shape of the muscles, the size, the number of heads or bellies, the position, the tab, attachment, and also the actions. You have 1, 2, 3, 4, 5, 6, 7. There are 7 ways how we name the muscles. So it can be based on the shape, based on the size, number of belly or heads, the position, and so on. That's how we name them. First, the shape. So the shape of deltoid means triangular. So the deltoid muscle here actually is a triangular. Or the teres muscles. Teres mean round muscles. Rectus mean straight muscles. For example, rectus abdominis. So it's a straight muscles. It is based on the shape. How about based on the size? The big muscles or large muscle is a major. For example, pectoralis major muscle on the chest here. This is a big muscle, so major. Or it can be based on the broadest muscles, the widest, the broadest. For example, latissimus muscle. Example, latissimus dorsi muscle, very broad muscles. Or it can be very long muscles. Then become longissimus muscles. It is based on the size. Or it can be based on the number of heads or bellies. As I mentioned earlier, bicep 2 head, tricep 3 head, quadricep, quad means 4 heads. 2 bellies means digastric. Di means 2. Okay, 2 bellies. Or it can be based on the positions, for example, of the chest, pectoralis. So when you say pectoralis, means pecto. Pec means that it's on the chest area. Pectoralis. Or supraspinatus. Supra means above. Above of spine of what? Spine of scapula. Supraspinatus. Or it can be muscles of the arm. This is the arm. So muscle in the arm known as brachii muscles. Brachii muscles. Or it can be based on the tab. Which one located more deep? Which one located superficial? Or which one located external or internal? For deep, normally we call it a profundus muscles. Superficial is a superficialis muscles. Or it can be externus, it's a externus muscle for external, or it can be internus muscle for the internal part. All right. Or it can be based on the attachment. Based on the attachment, for example, sternocleidomastoid muscle. Sternocleidomastoid. Sternum means from the sternum, and clavicle to mastoid process. from where to where. Sometimes by looking at the name of the muscle, then you know it connecting from where to where. Another example is the coracobrachialis muscles. From where? From the coracoid process. Brachii is a arm. From coracoid process to arm, right? Okay, coracobrachialis muscles. Or it can be based on the actions. Actions, extend, flex, constrict. For extend is extensor, flexor, flexor, constrict is a constrictor. Okay. Or it can be based on the adductor, ADD, adductor muscle. Okay. So it will adduct. For example, these names are commonly used in combination. Examples: flexor pollicis longus. Flexor is a flex to flex, and the longus is a long flexor, longest, long. Pollicis means your thumb. Right? Pollicis is a thumb, right? Hallucis is your big toe, right? Okay. So pollicis is your thumb, right? So it's a bone marking. If you study the bone, but I don't expect you to remember all. No, it's just that when you read a lecture note, and then you suddenly realize what is a line, ridge, crest. Remember the linear elevation, the elevation, like linear ridge and crest, or it can be in the form of rounded elevations, like tubercle, protuberance, tuberosity, or trochanter. Or it can be sharp elevation, like spine or spinous process, or styloid process. Or it can be in the form of expanded ends for articulation, like the head, condyle, epicondyle, small flat area for articulation like facets, depressions like a notch, groove of sulcus or fossa, and then openings. There's openings, the bone like fissures, foramen, canal, or meatus. Yeah. Okay, I'm done with my lecture for this introductory lecture on the anatomical terminology. Yeah?